Hi, good afternoon, interprofessional community. I say good afternoon from the United States, where some of us are presenting from, but not our speakers. Our speakers today, Dr. Catie Canavan, Karlee, and Emily, are joining us from Mountain West time, a different part of the United States. We thank them for joining us today, but most importantly, thank you all for joining us today. You've all been investing in your own time in your professional development, and we're so excited that you've chosen to spend the next hour with us today. So just to give you a very brief overview of what you can expect with our format, first of all, you'll hear from our presenters, a fabulous topic titled slide on the screen, investigating the role of occupational therapy in postpartum care and the impact on maternal psychosocial well-being. You'll hear a presentation, and then you will also be presented with a case study. This is an exciting element of the ECHO platform. We'll send you into breakout rooms with a facilitator, and you'll have about 10 or 15 minutes to discuss elements of the case study. And we'll come back to the large group, and then we'll have our final discussion facilitated by our speakers today. So we want to make sure everyone, of course, registered. You're here because of that. You'll also, our platform and your registration also support your continuing education. We just, again, ask you many times to ensure that you're filling out any surveys that you get from the ECHO platform to support ongoing data to ensure your positive experience with this program. Great. So I'm going to launch off first to Dr. Catie Canavan. Welcome, Catie.
Thank you. Thank you, Dr. McKinnon. It's nice to see you today. So Dr. McKinnon reached out to me as a former student of hers asking for a presentation about maybe some of my clinical expertise. And in full disclosure, in 2020, I transitioned from the clinic to academia. So I have been a faculty member at Idaho State University as an emergency hire to help cover some lab coursework that needed to be covered. And then I transitioned to the clinical education and fieldwork coordinator role, and about a year ago I transitioned to the program director and chair role. So because of all of the changes, I really haven't had a ton of clinical work recently and didn't know what to share with you all. So I started thinking about what my students have been excited about and what my students have been working on. And this topic has been incredibly exciting and well received at presentations with AOTA and the Idaho Occupational Therapy Association. So I thought it might be a nice presentation to share with you and highlight some student work. However, Emily and Karlee have recently graduated and are now registered occupational therapists in the US. And I think last I heard from Emily, she's just waiting on her state licensure from the state of Arizona. So today, what we are going to be presenting, our objectives for the presentation is by the end of the presentation, all of our learners will be able to have an understanding of the research that was completed, identify areas that occupational therapy practitioners may impact during postpartum care for both the mom, the family unit, and the baby, and demonstrate knowledge through case application and discussion, occupational therapy interventions that may support the psychosocial and physical well-being of new parents. So I'm going to turn it over to Emily and Karlee now.
I'll start out on talking about kind of the background of this topic and kind of what got us into doing this research. So when we were talking about it, none of us are mothers, and we were had been experiencing, like, some of our family members and sisters, cousins had been experiencing it, and we kind of decided that we wanted to go in, or had just had babies, and we're experiencing some like difficulties finding help and getting the psychological help that they needed. And so when we started doing some background, we found that although maternal mental health and physical health is of utmost importance to the well-being of families and children, It is often one of them that are very overlooked, and mothers are grossly underserved. In the US, we found that a lot of times the mothers go in for their 6-week appointment and they get a piece of paper and they fill out a survey. And that's kind of what determines if they think they have postpartum depression or anything else. And then after that 6-week appointment, usually it's not discussed again unless they bring it up. And then pregnancy and childbearing can leave mothers with PTSD, anxiety, or depression, which may affect the mother-child relationship, successful feeding, a child's development, and even mortality and morbidity rates. And then we found one study done by Moore in 2021. And once they found that 1 in 5 postpartum women have been diagnosed with mood or anxiety disorders that occurred during pregnancy period and or after the birth, or up until the first 5 years of the child's birth. And then researchers in that one also found that maternal PTSD is related to success with infant feeding and sleeping. Adjusting a mother's psychosocial functioning, it can provide providing adequate and appropriate postpartum care can also help with the child's psychosocial functioning and overall development. So they can provide we can provide in-depth education, manual therapy, equipment recommendations, positioning, and energy conservation training and modifications for general postpartum recovery, C-section recovery, returning to sexual activity and other experiences. That was also something that they found in that same study that occupational therapists really helped with. And then our study, it was aimed to fill in the gap in current research. The purpose of the study is to identify the psychosocial postpartum care received by mothers and to recognize the role that occupational therapy services can play in improving that maternal mental health. And if you want to go to the next, study materials. So for data collection, we had to get approval from our institutional review board. We used relevant Facebook groups, and that was kind of specifically in this Eastern Idaho area, just because that's where we were located. We were then emailed kind of the people that were in charge of it, the admins, to make sure that we had approval to post this. And then we posted a questionnaire with the description of the research study. Participants must have been given birth in the last year. The survey included questions about how moms felt after birth, the support that they had or wish they had, what was difficult to adjust to, and if they had postpartum depression, while also considering demographic factors. And then to analyze this data, we use the Braun-Clark's 6-step iterative framework to perform a thematic analysis on it. So 3 decision points regarding these themes were considered. Did the themes make sense with the context of the data? Were overlapping themes really separate themes? And are there any themes within the themes, like sub-themes? And how do they relate to the main themes? And then we identified 2 main themes from all of that. And then I'm going to turn it over, I think, to Emily now.
Excellent. Thanks, Karlee. We're glad to be here, and it's nice to see some of your faces. So I'm going to talk a little bit about the responses that we received. So we had 64 women who took and completed the survey and had all of the inclusion criteria that we decided. So we had women ages 20 to 36 years old respond. With the majority of our recipients of the survey were Caucasian, although we also had 1 Native Hawaiian and Pacific Islander, 1 of Black or African American descent, and 1 of Asian American heritage. And the majority resided in Idaho, 36 of our 64 participants, as well as other states from across the United States, including those listed right here on the slide. And you can go to the next one. So we want to talk a little bit about some of the strengths and limitations of this study, as that's important whenever we're looking at research. So we did have lots of participants from across the United States, which was great. A majority from Idaho, which is where we are basing our research, but a lot from across the United States, which is great. However, also on the limitations, we only had participants from the United States, which that makes it a little difficult to take the research outside of the United States, although a lot of the findings that we will talk about in the next couple slides we feel are really relevant. Another good strength from this was that it was a combination of both quantitative and qualitative data. So we had some very strong numbers, as well as we were able to hear from these mothers what their experience was, and have a greater understanding of some of the things that they experienced postpartum. And then on the other side, our limitations, like I said, we only had participants from within the United States. We also used Facebook to recruit for our survey, which limits the people to those who had computer access, as well as those who had the ability and the support of these online maternal health groups. We also had limited cultural and ethnic diversity, as the majority of our participants were Caucasian, as well as from the United States, as we talked about. And the survey format sometimes has a little bit of a limitation, as they can respond to the questions we ask, and there isn't more of an interview process where we could learn even more about their experiences. All right, so in the next two slides, we're going to talk about the two main themes that we identified from our research. Like I said, we had both quantitative and qualitative data, so we had lots of really great comments from these mothers about their experience postpartum. So the first theme that we identified was that there is an inadequate mental health focus for postpartum mothers. And we kind of broke this down into three subcategories of how this all relates to one another. So the first one was that there was a lack of postpartum care that was focused on the mental well-being of the mother specifically. A lot of these women talked about how they felt that their mental health was being overlooked, that there was just a generic question of how are you doing, or how's your mental health, that was kind of vague and difficult for these women to pin down, especially when they are experiencing such emotion or occupational disruption, that that's sometimes a vague and really difficult question to answer, and that it was brushed over really quickly. One participant said that aside from the generic "how are you feeling" question I was asked at my 6-week appointment, I was not asked one other time how I was doing mentally. And as we learned through this research, that's always something that is evolving, that is changing from day to day and week to week. So these women were only asked that a few times, if at all, which is an interesting part of the research that we found. Another subcategory under this was that there was an insufficient resources to support their mental health. One participant said that there were no flyers or discussions about what motherhood may look like, how I would feel, when to ask for help, and they sent me home with nothing, and I was totally on my own. So this, as this woman said, as well as other mothers within our research, that there was not a lot of information, and as there were a lot of first-time mothers in our participants, as well as lots throughout the world, it's hard to know what to expect and some of those warning signs. A lot of the women also talked about in the subcategory that they were told maybe how to change a diaper or how to swaddle, but not on the emotional and mental toll that it would take to have a newborn. And then the third subcategory that we found under this theme was that participants wish that they would have had a lot more support, and they talked about some of the supports that they wish that they would have had. So one participant said that just deeper conversations on depression, changing bodies, and the feelings that come after, they are so uncontrollable. And another participant said, I wish they would talk to me about when baby blues should disappear by, when to know what I was feeling wasn't normal, a list of thoughts or feelings that could be a sign of a more serious mental health condition. And as Karlee talked about before, a lot of these women, this was the first time that they've had this anxiety or depression. So they really wish that they would have had that support to kind of tell them what to expect if this is something new that hasn't come up before this postpartum period. All right, and then the second theme that we identified was just an overall lack of maternal support. So these two themes go hand in hand because all of this is very interlocking as the experience is very complex. But with under this, we also identified three subcategories. The first being that there was an insufficient depth and frequency of medical appointments postpartum. Mothers said that they felt that they were overlooked, where their physician only focused on their baby's health instead of theirs. They had the 1 6-week appointment and then that was it, that they didn't feel like they had adequate care or education guiding them through this process, both physically and mentally. One participant said that no one at the hospital, my doctor's office, or the pediatrician seemed to care at all about how I was doing, only my baby. And when I would say things that I was feeling, they didn't seem to care or ask more. While another participant said the questions I asked were answered, but the information wasn't just given. I had to know what to ask for, which is really difficult when you are in the middle of this and you don't know what you don't know. So there was not enough given to I guess a baseline for mothers to kind of know what they should be seeking for, that they really had to advocate for themselves if they were to receive education in general. Another subcategory was that there was a focus on pregnancy and birth rather than the postpartum period and adjustment to life after that, as well as just a general lack of resources. So one participant said, I wish there were more options or free options that helped women understand what will happen to their body, sex life, mental health, and all the changes life brings after having a baby. While another one said, after I gave birth, I got a pump and zero information on how to use it and when to use it, phalange sizing, sleep deprivation, emotions, nothing. So these two women talk about their experience, that they kind of felt thrown into the deep end, that there wasn't enough information given to them in that postpartum period. Whereas other participants also talked about that they wish that they would have gotten education and training on pelvic floor health, breastfeeding and lactation, what to expect life with a newborn to be like, sleep training, and many other relevant aspects of childbearing and that whole process. So we see here that there is a big combination of both a lack of physical and emotional comprehensive care for these women. And then the last subcategory in this section was that women identified a lack of social support. They talked about a desire for peer interaction and support groups to talk about shared experiences that they had, encouragement for one another, sharing useful tips, and all that kind of things. One participant said that I wish the default was to enroll you in a peer support group with other mothers. It's so hard to find the motivation to look for something when you feel you need it most. And a lot of women said the same thing, that peer groups were few and far in between, that it was hard. If there was one, there was a really long wait list. And when you're in that moment, it's hard to have the motivation to seek something out, especially if you're hitting roadblocks along the way. They also talked about in this social support ways that they wish that their family or partners or close friends could have supported them better in those moments, as far as support from them goes. So this leads us into the next section, which is, with all of this information and all of these things that we've been hearing from these postpartum mothers and their experience through the childbearing process, what can we as OTs do to help them and support them? And how is this relevant to occupational therapy? So to start off, as we learned from all of that research and the responses from these women, there is intense occupational disruption that happens throughout the childbearing process. It affects everything from ADLs of the mother, of bathing, eating, dressing, grooming, and hygiene, to IADLs of home management and meal preparation and taking care of others. It can severely impact sleep and leisure, social participation. Basically, all of the ADL routines are changed. This big role throws a wrench in the things that are happening in one's life and can be really mentally and emotionally challenging, as we've learned from the past two slides. So as occupational therapists, we can provide a unique and holistic perspective with a focus on maternal well-being, which is incredible. So what are some things that we can do as OT practitioners? We're going to talk more about this in the case study, but here are some main things that we identified throughout our research. So the first is that focus on collaboration to provide holistic interventions. So a lot of these women felt like their healthcare professionals were very quick with their questions and didn't provide that holistic intervention. So we can come in and have that collaborative relationship with our clients and really get to the bottom of the things that they're experiencing and use active listening to find out the root of their occupational disruption, and then use some of these other bullet points to help fix that. But I think that that's something really unique and wonderful about OT, is that focus on collaboration and a holistic view of an individual and a family. So the next one is advocacy and self-advocacy. That's a big part of occupational therapy. And these women that responded to our survey talked about how if they wanted education, they had to advocate for themselves. If they needed support, they had to seek that out. So that's something that's a great part about OT, is we can teach those skills of advocating for them and teaching them to advocate for themselves with their physicians to get adequate resources and have their needs met. Also advocate for their family members and their partners and their support groups to let them know what they need, advocate for their mental health and opportunities to socialize with other mothers and learn from them. So that's an excellent part of that. A next thing is helping them establish healthy routines. I feel like this is the bread and butter of OT, is creating routines that are successful and can help these women in their new lives, teaching them what a routine might look like and giving them resources to have a healthy routine with a new baby, and kind of working in and problem solving some issues that come up with that. Next is incorporating effective coping skills for anxiety and depression. This is definitely an emerging practice area in occupational therapy with maternal health as well as with mental health, and giving them some tools to have in their tool belt, as this might be a new mental health challenge or mood disorder, or something that is recurring from earlier in their life. The next is modifying the task or the environment to make it more friendly for a healthy routine, as we talked about before, or teaching them in the next bullet point, ergonomics and energy conservation to help them as they have all of these new demands. There's lots of tips and tricks that we can give to them to make them more successful in their routines and this new way of life.
Okay, so we did put together a case study example for you, and I will first acknowledge that the case study has a very Western bias, because that is the experience of the three of us who are presenting today. So our case study example is Sally, a 25-year-old female who had a planned pregnancy and gave birth to a healthy, full-term male child via vaginal delivery with no complications. The child weighed 7 pounds 5 ounces at birth, and mom and child were provided couplet care throughout the 2-day hospitalization and saw a lactation consultant nurse one time to support breastfeeding. Sally's significant other remained with her and the child throughout the stay and upon discharge to home, and they were supported by extended family members. Upon discharge home, the baby was seen by the pediatrician 2 to 3 days post-birth, and again 2 weeks later, and mom was seen by her OBGYN 4 weeks post-birth. Related to their occupational performance, mom and baby were successful with breastfeeding, though the baby fed every 2 to 3 hours around the clock. Sally was able to complete basic ADL activities with increased time initially. However, due to sleep deprivation and adjusting to being a first-time parent, she did not engage in these activities on a routine basis. Sally only left her home during the first 3 months of parenthood to attend physician appointments for herself or the baby, and did not engage with family or friends during this time period. None of the medical providers or support people asked Sally about her mood or engagement during these visits. So as you go into your breakout rooms, we have 4 questions that we would like you to work on together. And the first would be to identify the components of the case study that led you as an OTP or an OT practitioner wanting to know more to support Sally, her significant other, and the baby during the experience. Next, as an OTP, what suggestions would you make to engage occupational performance and role competence for Sally and her support system? Question number 3, if medical providers did refer Sally, the baby, and her support system to you, what evaluation tools, so either formal or informal, would you use to identify further need? And the last question, what OT interventions do you envision being appropriate for Sally, her baby, and the support system?
Excellent. Thank you, Katie. We are, let's see, Kate, I sent a message. I hope that you can help with breakout rooms. Thank you so much. I just don't have that capacity. For our facilitators in the room, I'm actually going to ask you to hang back for a minute so that we can make sure we send people to appropriate breakout rooms. Is that okay, Kate?
So, and Sarah, there's actually a question in the chat about what practice setting this would fall under.
Great. Go ahead. You can take that, Katie.
Absolutely. So I think the question is, what practice setting would we be seeing this person? Would it be in the doctor's office, primary care, or some sort of OT referral system? This is not my area of expertise.
Katie, I'm going to interrupt you right here because everyone left to go to the chat. So sorry, let's answer that question once again when everyone comes back. I'm sorry, I opened the rooms right as you were answering.
Oh, cool. That's okay. Great.
All
Thank you.
Thank you, everyone, and welcome back from the groups. Our first question was, what have you learned during this presentation that you can apply to practice? Jen Nordstrom, do you want to talk with what your group came up with first?
So actually, Kate, we had questions and then we had for them to reflect on in the breakout rooms, and then these are just some general debrief.
Oh, sorry. Can you pull up the breakout room questions?
Yep, there we go.
Perfect. All right, sorry about that, my bad. So the first question was, please identify components of the case study that leave you as an OT practitioner wanting to know more to support Sally, her significant other, and the baby during this experience.
So my group had discussed one of the biggest things was to kind of get an idea of what were Sally's roles and routines and habits and interests prior to having the baby, to be able to get a better idea of what she was doing before and what they would then be kind of trying to readdress her back to.
Great.
That was the primary answer.
Fabulous. Sarah, did your group have anything to add to that?
We did bounce around a little bit, so we didn't actually, well, I guess we did talk about this. We're interested in a few things. We're knowing a little bit more about the environment, the social support. We're also wanting to know if there's more children involved. You know, for example, other babies, or again, I forget that Mrs. Sally is a first-time mom, but we also think it's really important to know who else is residing with the child and with the family component as well.
Great. Timothy, did you have anything to add? No? All right, we'll go to the next one. Oh, go ahead, sorry.
Well, yes, Kate. So with the first question, we had the inadequate mental health focus for the postpartum moms. There may be lack of the care postpartum. We talked about the education, whereby from our case study, we saw that the moms did not were not like the hospital. The practice had the resources, how to use them. Then we talked about the ADLs on a routine basis. We talked about social participation. Yeah, that was for our question 1.
Great. Timothy, that last word that you said, did you say social
you.
participation? You said something.
Yes, social participation.
Okay, great. Thank you. I just want to make sure I heard you correctly. Okay, George, did your group have anything you wanted to add?
Thank you. In my group, we have discussed also for the first question, area for the OT must interview. So first of all is mental health, fatigue management, social participation, and the family dynamic. Thank you.
Great, thank you. Adonis, did you have anything you wanted to add from your group?
Sure, we'd like to investigate what support she has at home, what's happening with her sleep and rest, and the other occupations, like IA deals.
Great, thank you. All right, I'm going to stay with you, Adonis, for the next question. As an OT practitioner, what suggestions would you make to engage occupational performance and role competence for Sally and her support system?
Well, we talked about suggestions to her family and friends to be close to her and care about Sally even via video calls and social medias. Encourage Sally, talk about her mental health and build stronger support system, and maybe creating routines around her daily activities.
Great, thank you. Sarah, did your group have anything to add?
I didn't write these down, so I'm just reverting back to our conversation. I'll actually pitch back to our large group if there was. But I do think that one of the things that we talked about here was ensuring that we have the ask more questions about what's disrupted and what things are the Sally is looking forward to getting back to doing, right? Because there's certain things that are acute, there's just truly a new role and there's more things to have to think about. But then there's other things of, wait, how can we do the things that we love to do maybe a little differently? Great.
Thank
I'm also
you.
going to pitch here too, just because I have to just do one thing. Is the other Sarah still on the call?
Sarah Scott, yes.
Oh, she is. Sarah Scott, would you be willing to chime in as well to the last question for our group, please? Okay, we'll see. And if not, then just skip over my group, please. Thanks.
Sarah, you're on mute.
Thanks so much. Okay. Okay, so I had wondered, some of the things that we've already talked about, but I had also wondered if it would be possible to involve either her partner or other family members in some of the tasks that might allow her to have more sleep, which would allow her to possibly return to better and more consistent ADL function. And then as well, just habit stacking, the use of, maybe there's a routine that's already going really well for her and perhaps piggybacking on top of that to add another one, just kind of a slow start back to a new routine. And just incorporating more people, because sometimes it does feel like it falls all to the mother. So just trying to broaden the care tasks a little bit out just from.
Great, thank you. Yes, sleep is so important. Jen, did your group have anything to add to that?
So my group actually gave great recommendations. They wanted to provide community resources to see if there's any other mom groups that the family could participate in and reconnect with. Also come up with ways to reconnect with her spouse without the baby and develop those roles and relationships. Maybe some education and training on any questions regarding feeding, bathing, dressing with the baby they can add to it. One other thing was, again, when you do have the supportive family, being able to kind of grade that based on Sally's needs at the time, so that there might be certain times in the day that she needs more help than others, and being able to get interest not only in the house but outside the house.
That's great. Sounds like that was a very productive conversation. All right, well, we are running out of time, so thank you all so much for joining us today, volunteering your time, and thank you for our speakers for volunteering their time and their expertise. We really appreciate it, and we hope you will join us next month. We meet the second Thursday of every month at 2 p.m. Eastern Time. So thank you so much, everyone. Enjoy the rest of your day.